Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper right and the lower right quadrant. On the panoramic view, you can see that the upper right second molar is root canal treated with a crown prosthesis on top of it. On the transaxial view, which is the proximal view, you can very clearly see that the upper right second molar has periapical radiolucencies on the palatal root, the buccal, the mesiobuccal, the distobuccal root, and we also have a radiolucency associated with the mesiobuccal root. You can see that there is a presence of a slight hypodensitia, which could be signified as a crack here in the mesiobuccal root. However, we will check other views to confirm, but we do see major periapical radiolucency with the distobuccal and the mediobuccal. There's also cortical plate perforation and a sinus tract formation in the distobuccal root associated with the the upper right second molar. So this radiolucency that you see here this one is associated with a sinus tract formation. So here you can see the sinus tract and here you can see the radiolucency associated with the distobuccal canal. Moving to the edentulous area in the first molar region, this region is edentulous. Here if we look at the ridge, it's 11 millimeters at a slight slant towards the palatal and we've got approximately 10 millimeters of height. So an implant placement in this region is definitely possible. This is the upper right second premolar, and you can see it has two roots and two distinctly different canals. This is the upper right first molar and first premolar, my apologies. This also has two canals and you can see the internal anatomy here quite normally. We don't see any sinus or any periapical radiolucencies. Now moving to the lower right region, lower right second premolar, you can very clearly see has a single root, but with a little bit of a bifurcation at the apex of this tooth. It has a curved canal right at the apex. We've got one single canal here, and we don't see any signs of cracks. We will check the other views for verification. This is the lower right sixth. This has a deep carious lesion, and secondary caries can be seen under the deep filling. Pulpal involvement does not seem to be positive at the moment. We've got two canals in the mesial and we've got one single canal in the distal. This is a one wide single canal in the distal that ends at one apex. We again don't see any radiolucencies or cracks or sinuses. This is the lower right second molar. This lower right second molar has fused roots at the apex which is visible, and we can see no periapical radiolucencies or cracks here. Now moving to the axial view, which is basically the top to bottom view. So this is the lower right hand side. So I'm going to zoom in because this is the lower area of interest. So now as we're moving down, you can see that there are restorations present, but none of the restorations are involving the pulpal chamber. We don't see any cracks or radiolucencies. Something to be noted is the lower right fold. So this line right here is the lower right first premolar. This shows a cracked line here, but this again needs clinical correlation if the patient has symptoms towards the lingual aspect of the lower right first premolar. The other thing to note is this particular line here in the distal, which can be seen right here. This line here. So this is something that we observe in the lower right first molar distal canal. We don't see radiolucencies intraradically, so this could be an artifact, but this requires attention and this needs to be clinically associated. Now moving to the upper right quadrant, the upper right quadrant definitely has a, so this is the upper right first second molar, and here you can see that the radiolucency is involving the interradicular area. It is also involving